Hi, my name is Dr. Ansel Johnson, and this is the next in our series on diabetes and diabetes eye care. So, if you are living with borderline diabetes or pre-diabetes, or if you're living with diabetes itself, you need to listen to this program and presentation. So, just get comfortable, get seated, and I'm telling you a little bit about myself. I am a certified lifestyle coach in the federal program for diabetes prevention. The CDC has a program for diabetes prevention, and I'm a lifestyle coach. And basically, what I do in my practice is not just examine eyeballs, but I help people get tips on how to change their lifestyle, how to change the trajectory of how they're living every day to prevent the conversion from someone being borderline diabetic to being diabetes, or to slow that trajectory down. Our whole philosophy in our office is wellness, managing your wellness. And medicine today can help keep us alive for quite some time. But I always emphasize with my patient, what is the quality of life that you want to have? We really want people to live their best lives with diabetes, with their best eyesight, because vision and eye health is our emphasis in our office, but we also make the connection between your body, your physical health, and the eyesight and the eye tissues. The eye tissues are so very susceptible to so many of diseases that affect our whole body, and diabetes is a prime example of that. And so today I'm going to focus on the three major eye conditions that diabetes can cause and can affect your vision. And the dangerous thing is that a lot of these things, these problems can sneak up on someone, and then all of a sudden they're running into our office with blurred vision or vision loss that comes on pretty quickly. Sometimes it's some things that can be reversed or improved, and then sometimes these are things that have already caused permanent damage that have been building and building over a number of years. So with regular eye care and extensive high-tech diagnostic equipment, a lot of times we can prevent the vision loss or prevent vision worsening secondary to living with diabetes. So the first condition I want to talk about is a condition called cataracts. So cataracts defined is a clouding of the lens inside the eye. Behind the pupil, the colored part of the eye, there's a lens, just like a camera lens. And that lens, oftentimes, just in general with age and over time, can start becoming cloudy or hazy. So that lens does not stay crystal clear all of our lives. So if you live long enough, generally, you can develop cataracts. Now, there are some symptoms of cataracts. Basically, the symptoms can be glare at night. Usually at night, people might notice a little bit more difficulty, and that can develop slowly over time. Just blurred vision in general is a symptom of cataracts. And then you can also have a clouding, or you feel that you need more light to see. You need more light to read, and that's mixed with the normal aging change where you need reading glasses. But in general, when you have that cloudiness or haziness in your vision, and you need more light to see, that can be caused by cataracts. So cataracts can take different forms. The clouding can be even throughout the whole lens, or you can get like little spoke-like opacities or cloudiness in the vision. And you can get glare. Glare is a very, very common symptom of cataracts, where you see starbursts from headlights on a car coming on board. And so cataracts can be quite debilitating over time. And a lot of people ask, well, I'm on a computer a lot, so does that cause cataracts? Generally not. Another cause for cataracts can be just exposure to sunlight. So if you're outside a lot in the sun and you don't have really good sun protection, that can hasten the formation of cataracts. So some people might say, well, what does that have to do with having diabetes? Well, when you're living with diabetes or pre or borderline diabetes, there are fluctuations in your blood sugar level. So blood sugar's going up, going down, stays the same for a little while, it's going up, going down. So it's usually a poor control of your overall blood sugar levels, which is why your physician will run blood tests to see what your average blood sugar is, or a random blood sugar test after you fasted or just any time of the day, just to kind of see where you're at. So those fluctuations in your blood sugar level can affect the lens. The fluid inside the eye goes in and out the eye because of the high sugar content that's in the fluid inside the eye and in your bloodstream. That can cause that lens protein products to form in that lens and get cloudy. So fluctuating blood sugar levels can cause a premature or more rapid clouding of the lens inside the eye, hence cataracts. So in my patients that are living with diabetes, a lot of times I can see cataracts at a younger age, a little younger than I expect, or the cataracts can progress more quickly. So say they just kind of fell off the wagon, just didn't eat right, holidays from, around Thanksgiving, Christmas, New Year's, and people just kind of let it all go a little bit. They may develop cataracts more quickly without really monitoring their lifestyle and diet and things of that nature. So that haze can start more quickly. So if you do notice more glare and it's starting to bother you, you want to get into your eye doctor to take a look at that. More especially or more rapidly if you're living with diabetes, because again, if you've just been diagnosed with diabetes and you've been put on medications and your blood sugar is fluctuating a little bit, we can get changes in the prescription. So cataracts can also not only cause blurry vision, but they can actually change your eyeglass prescription. And we've seen that happen on many times. So because the shape of that lens is changing, your prescription for your glasses or contact lenses can change also. So just be aware of that. So cataracts, and that can happen in both eyes equally. It can happen usually in one eye advances more quickly than the other eye. Doesn't matter, but for whatever reason, they can develop more asymmetrically or more in one eye than the other. But it can also definitely affect both eyes. And it usually does. Other symptoms, again, glare at night, blurred vision, fluctuations in your vision. And as I tell some patients, if their blood sugar is fluctuating due to those lens changes in the eye, it might be a good idea to wait to get your glasses updated until your blood sugars are stabilized. Cataracts. The second biggest and most common eye problem we see that can be quite devastating is glaucoma. Now, well, let me go back a little bit and let me finish up on cataracts a little bit. The one good thing about cataracts is that they're easily treated surgically. So cataracts are not treated with any medication or anything like that. When it gets bad enough to where you can no longer do the things you normally like to do with your vision, that means driving at night is a really big problem, working on a computer is a problem, the glare is just real bothersome, then that's the time when you should consider cataract removal or surgical treatment of cataracts, which is the standard. So there's a big fear when you use the S word, but cataracts, actually treatment of cataract surgically is pretty routine nowadays. It's an outpatient procedure. People generally are not put under general anesthesia. They usually, the more cutting edge care, they just put a drop in both eyes or the eye that they're doing the surgery on to numb it. And they may give you something to put you in twilight without putting you under general anesthesia, just to calm you down. The actual procedure, in most cases, takes about 10 minutes in the hands of a good surgeon. So if cataracts are left to progress a long time and they become really hard and really dense where you can barely see in front of your face, sometimes we see that in some of our seniors that might be homebound and couldn't get out to see the doctor. By the time we get to see them, that cataract is dense. That can be more of a complex procedure to remove that cataract. Still outpatient, but more difficult, more complex, because that lens is really hard now. It can be difficult. So outpatient procedure takes less than 10 minutes in the hands of a good surgeon. Usually do not do both eyes at the same time. So one eye is done, and then the next week or two, the surgeon may schedule the second eye to be done, if it's equally bad or if that's bothersome too. So generally good outcomes, over 95% good outcomes. But again, having or living with diabetes can complicate things a little bit that we have to watch for in the back of the eye. So that's cataracts, what they are, how it's treated. I wish there was a drop to help dissolve them. I think people are working on that, but basically right now the standard of care is surgical removal. Now, I started talking about glaucoma. Glaucoma is a different set of problems, different in the part of the eye in the back that where the nerve is affected that connects the eye to the brain. And many people have heard of cataracts and glaucoma, and they get them mixed up, but that's okay. That's why I'm here. Glaucoma is a disease that affects, it's a family of eye disease that affects the nerve behind the eye. So that nerve slowly becomes damaged over a period of time. Sometimes it's related to a high fluid pressure in the eye because the eye is filled with the fluid, and that pressure we can measure just like measuring air in a tire. So that fluid pressure can build up and actually start damaging that nerve that connects the eyeball to the brain. The reason that's important is because if you lose that nerve connection, I don't care how thick a pair of glasses you wear or how bright the light is, that nerve is not going to transmit that light signal to the brain because we actually see with our brains. They're not going to transmit that signal. So it's just like trying to run a race and you cut your Achilles heel or you cut a muscle, you're not going to be able to walk or run too well at all, even with a crutch. So glaucoma slowly affects your side vision to where someone develops tunnel vision. So there are no early symptoms for glaucoma. I have a lot of patients that have advanced glaucoma, tunnel vision, they can't see past here. But they may have 20/20 or slightly less than 20/20 vision looking straight ahead. So looking straight ahead, they can see fine. The problem with that is that you can lose your driver's license privileges because when you drive, by state law, you have to have a certain amount of side vision to see the cars and pedestrians around you. So even though you can have 20/20 vision, when you lose your side vision, you can lose your driving privileges. And that's what makes it so very, very dangerous. Whatever vision that you have lost from glaucoma because of that nerve damage, you cannot get it back. We cannot yet regenerate that eye nerve tissue. A lot of people are working on it, but right now we cannot do that. So once that whatever vision you've lost, it's gone. So our fight, again, in terms of managing eye wellness is always to help people keep the vision that they have. So when we see early changes, we have technology that we can detect early changes, early nerve damage from glaucoma before we can even measure vision loss, even in the side vision. So that's what I always get excited about every day in my office. If I have somebody that's slightly at risk for glaucoma, I have baselines, I have technology, I can measure a lot of different things, how thick those nerve fibers are in the back of the eyes, and that's our baseline. And when we see changes over time, we can act upon it. Now, how does that relate to diabetes? Well, again, diabetes affects the circulation, the very tiny, delicate blood vessels inside the eye. So the circulation of the blood inside and around the nerve in the back of the eyes, if it fluctuates, if it's damaged by diabetes, that affects the nerve, and the nerve can start becoming damaged because that nerve is not being nourished well enough to stay healthy. So again, the nerve is not being nourished well enough to stay healthy. So that is one way in which diabetes can affect the nerve tissues in the back of the eyes. So we look at all of that. We can examine the the blood vessels, the nerve fibers, measure how thick they are. And how can we help that? Well, managing your diabetes, keeping your blood sugar stable, keeping you want as healthy as blood flow in your whole body as well as the eyes as healthy as possible by maintaining good, healthy blood flow. Another lifestyle change is just exercise. Good cardiovascular health will help the circulation in the nerve and inside the eye. So in other words, raising your circulation, your heart rate with your physician's advice. So again, you want to talk to your physician about any kind of exercise or activity program to see if it's okay for you to get started. But activity, good cardiovascular health is very helpful for diabetes and the circulation inside the body. And I've said before in other forums that diet is 80% of the battle. So decreasing the amount of meat, watching your carbs, just eating healthy, more of a plant-based kind of diet has been shown time and time again to be healthy for people. Again, moving more towards plant-based diets, the closer you move towards it, the better off you are. So again, that's glaucoma, where you lose your side vision. There are no early symptoms, so that's why regular eye checks are really, really very important. In our patients that are initially diagnosed with diabetes, a lot of times your physicians will tell you right off the bat, get your eyes checked because of these reasons. Type 1 diabetes is a little bit different because generally people with type 1 diabetes, a lot of times we will find that they're symptomatic earlier. It's found more commonly in youth, teenagers, 20s, although it can happen at any age. Usually it's found before the diabetes has been present long enough to cause damage. So the urgency for an eye exam with type 1 diabetes is not quite as immediate as with type 2. And the last and probably the most devastating, let me go back again in terms of glaucoma. How can we treat glaucoma? Well, the most common initial treatment of glaucoma is eye drops. And the eye drops, how we treat glaucoma is lower the fluid pressure inside the eye. So eye drops are generally the initial treatment of choice for people living with glaucoma. There are some laser surgical techniques that can also lower the fluid pressure, but the general standard of care is eye drops to lower the fluid pressure. Once it's caught early, glaucoma is generally easily managed, but it is lifelong therapy. So again, when you catch it early, before you have measurable vision loss, the odds are probably over 90% that you can live a life full of your functional vision from glaucoma. So it's not a condemnation that you're gonna go blind if you've been diagnosed with glaucoma. The third and probably the most commonly devastating effect of diabetes is diabetic retinopathy. And diabetic retinopathy is a fancy eye care term for changes in the back of the eyes that we look at bleeding, swelling, and scarring of the very delicate tissue in the back of the eyes. And the thing of it is, diabetic retinopathy can happen and not affect your vision for a while. Diabetic retinopathy can happen in your peripheral vision in the back of the eye that see, in the parts of the eye that see out here. And so your clarity is not going to be affected. But the thing of it is, if you have those changes, your leaky blood vessels and all in the back of the eye in an area that you might not notice in your vision, it can happen all of a sudden in the area with your central or your straight ahead vision. And people will feel that all of a sudden things are blurry and the vision has gone away or gotten really hampered. And so if we see any diabetic retinopathy or significant vessel changes like bleeding and scarring or swelling in the back of the eye in any part of the eye, we go on alert and I'm really defensive about our patients. Sometimes they may not need a treatment. A lot of times they may need medication injected in the eye to help make that swelling and stop the blood vessels from leaking and bleeding. A lot of times when we see early changes, we just observe the patient and really work on them in terms of taking the medication, lifestyle changes, diet, activity, those things that we know will control their blood sugar, lower their blood sugar, and hopefully stabilize those changes in the back of the eye. Diabetic retinopathy, again, leaking blood vessels in the back of the eye. And also, before you even get the leaking of the blood vessels in the back of the eye, a lot of times we'll see narrowing of those blood vessels. What most people don't think about, most people that have diabetes can die or get ill or be disabled because of a stroke or heart attack. So when we see that narrowing of those blood vessels in the back of the eye and that person's diabetic or living with diabetes, I guarantee that narrowing is in the kidneys that can lead to kidney dialysis, is in the brain that can lead to a stroke, or it can be actually narrowing of the blood vessels in the heart, which can lead to a heart attack. So when we see those changes in the eye, they will exist in other places in the body. So those are things that I counsel my patients on to really work with their physicians or with their diabetes educator to really work on lifestyle and change that trajectory of their life. Again, to live a better quality of life living with diabetes, that can be done. Diabetic retinopathy. Again, early changes is best treated with your lifestyle changes, with your food. Your food is your best medicine. And I really work hard for our patients, even with borderline diabetes, because we have patients with borderline or pre-diabetes with similar retinal changes. I have had patients with borderline diabetes that have leaky, very mild, very trace bleeding in the back of the eye, or leakage of blood vessels in the back of the eye, swelling in the back of the eye that have only pre or borderline diabetes. At that stage, it can be a lot of times reversed or definitely stabilized. So don't take having borderline or pre-diabetes very lightly. Again, getting to the treatments, early treatments for diabetic retinopathy, it's just lifestyle changes, taking your medications, getting your blood sugars under control. And then sometimes we just cannot prevent the progression. So that's when you have injections, and injections for diabetic retinopathy has been a godsend for so many people that has helped preserve or save their eyesight and prevent it from getting worse. But again, my philosophy, when you're first diagnosed, or if it's been over a year since you've had your eyes examined and you're living with diabetes, you gotta get into your eye doctor, have that dilated exam, have a full retinal or imaging done, in-depth imaging done of the back of the eye to see if there are any defects, any leaking, anything that can be going on that we can monitor possible progression, or hopefully that it stays stable. I tell all my patients, I want every visit to my office to be boring. If you have a problem, we want it either be better or it's not getting worse. But that's a team effort. And so I encourage everyone to talk to their doctor about getting an appointment or referral for a diabetes educator. Here at our office at Vision Sign, we are the only eye care facility in the state of Illinois, and actually on one of two in the United States, but we're the only eye care facility in over half the country that has its own nationally certified diabetes educator program. So it took a lot of work, took a lot of pride in there, and it allows us to help people on a day-to-day basis on how to live your life best with diabetes. I also want to put in a plug for our not-for-profit organization, Healthy Living with a Vision. HealthyLivingWithAVision.org is our website. So with Healthy Living with a Vision, we have doctor panels that will come to your church or library or your organization, and we will come and talk about diabetes, diet, lifestyle, how to live your best life with your best health. And we talk about various health topics. Today, again, our focus is diabetes, but if you are interested in our not-for-profit, HealthyLivingWithAVision.org, coming to your organization, you can email us at hlwav.20@gmail.com, or look at our website, healthylivingwithavision.org. Message us. We're also on Facebook, and we'll see if we can get a panel of health experts out to see you. That's about all I have today in terms of the eye complications related to diabetes. There are others. People can actually experience what we call neuropathy, which is a thinning of the nerve fibers in the back of the eye. A little bit different from glaucoma, but it can affect the nerve fibers in the back of the eyes. People can actually get double vision. A lot of times we see patients that develop dry eyes due to inflammation in the whole body, secondary to living with diabetes. So dry eyes can also be an early sign, but most people don't make that connection. So those are things that are fairly easy to treat, but it's a customized treatment depending on the person. So double vision can be a scary thing because, again, it can reflect nerve damage in the connection between the eye and the brain. In other places, people have neuropathy where they lose sensation in their hands and feet, things of that nature. So these are less common eye symptoms, but we do see dry eye quite a bit. But with all of that, I've gone on long enough. Feel free to hit my not-for-profit, HealthyLivingWithAVision.org up, and we always fight hard to help you see well, be well, and be blessed. Thank you very much.